This is an important paper in my view because for the time being we use for the stem cell transplant decision some prognostic model that can identify patient at higher risk on the basis of the natural history of disease. And we use IPSS, the IPSS, MIP70, MIP70 version 2+. And all these parameters of these models can help us identify those patients at high risk of mortality. So today, we decide stem cell transplantation for patients with higher risk group within these 3-4 models. And then we also apply the MTSS score model that can predict survival after stem cell transplant. So there is a combo of patients at high risk for the disease and lower risk for mortality after stem cell transplantation. But the question for research is when to transplant a patient within these conditions. For doing this, together with Nico Gagelman, we decided to take a big, huge number of patients, carrying patients from different cohorts, the MySEC-PM for the secondary myelofibrosis, and another big cohort, the Ruxo cohort that was developed mainly in Italy. So doing this, we have practically patient receiving ruxolitinib, that is the standard of treatment today. So the situation is within the context of contemporary treatment. And so the aim is to define the timing, as I said, and we found that we have to proceed with stem cell transplantation earlier in those patients with a higher risk disease and a lower risk MTSS. We can delay stem cell transplant in those patients with lower risk disease and lower risk MTSS. This is a balance, okay? When you have differently a patient with higher risk MTSS and higher risk myelofibrosis, you can probably delay because the risk of mortality due to stem cell transplant is too high. So I basically think that this can help us in the future managing of patients with myelofibrosis, according to this new multi-state model for statistical analysis. That is a statistical analysis that they take into consideration that a patient can change his state or the state of the disease over time.